Okay, guys. The recording. Yes, perfect. Um, sorry. Anyway, so let's start this class. This is we're going to be talking about mostly about viral genital infections, and really we're going to be focusing on two different type of viruses. One is a human herpes simplex virus, HSV2, that is mostly related to genital herpes, and human papilloma virus. That is my favorite virus because it's a virus I've been studying for most of my career. That is involved with genital warts and, of course, cervical cancer. So this is just an example of a clinical presentation. 26-year-old male liberal art college students visited a primary care clinic seeking medical attention. He was very concerned about painful, itchy sores, blisters that have developed on the shaft of his penis. He had low-grade fever, malaise, and a mild headache. The patient has no significant medical history. He admitted to have unprotected sex with a new girlfriend 3 days before arrival at the clinic. The physical exam, erythematous vascular lesions of the penile shaft, clear discharge from urethra, tender inguinal and lymphadenopathy. So, of course, differential diagnosis, chancroid, genital herpes, syphilis, chlamydia, so on. Comments, they have a painful vesical lesion, typical of sexual transmitted virus, not associated with syphilis. Chancroid may produce painful ulcers, uh, other generally produce painful ulcers. So you, by diagnostic workup, you do a rapid plasma serology to rule out syphilis. You can culture HSV2 and Haemophilus through, in vitro, and you can look for Sang smears. So Sang smears is, these typical multinucleate syncytial giant cells. They are mostly good sign that there's a viral infection, but these are not specifically for herpes virus, so they could be different type of virus that can cause Sang smears. The other way to do it is to infect cells in vitro and look for cytopathic effects. So you can see here, this is just carpet of cells in vitro and growing, and the moment they get infected with whatever the patient sample, you start to see cells how their phenotypes completely change to more like a cytopathic effects. Treatment patient was given oral acyclovir for 10 days and gradual resolution of lesions. So the history of herpes goes way, way back. We're talking about thousands of years ago. Hippocrates documented herpes virus infections, in the 500s BC. These cutaneous lesions of herpes simplex or varicella zoster. Now, even the Greek scholars termed the name herpes from herps, from herpeton, or a creeping creature. So at that time, we're talking about thousands of years ago. People thought that the herpes or the lesions caused by herpes, they were imagining these little salamanders under your skin, crawling and creating these lesions, and we're gonna see that some of them, like this herpetic whitlow caused by herpes viruses, that's the way they imagined. They imagined these little tiny reptiles going under your skin and causes this type of diseases. Now we know, of course, that herpes viruses can infect literally all species of vertebrates or invertebrates organisms in this planet. Once infected, one of the characteristic about herpes viruses, and the moment they infect you, there's going to be your body for the rest of your life. I'm going to explain to you why. It's literally almost impossible to get rid of herpes viruses in the moment you get infected with. So characteristic of herpes, they're part of the family of the Herpesviridae. They are large, between 150 to 300 nanometers. So they're actually a big viruses, they have this fragile envelope. They have this linear double-stranded DNA genome that is pretty huge. It's 125 to 230 kilobases, and they express more than 80 different genes. I know people that have studied all their life herpes viruses, and we still don't understand the function of all these genes that these viruses express. They have this hyposaccharide capsid, proteinaceous tegments around the nucleocapsid. We know that there are around 37 herpes genes that are indispensable to viral survival. And there are other 47 herpes genes that are mostly related to modulation of cellular environment. This is just a table of the different herpes viruses that are related to human diseases. We cannot talk about all of them, of course, in just one class, but we're going to be mostly focusing on HSV1 and HSV2. They are related mostly to oral or genital herpes. But of course, varicella zoster or chickenpox or shingles is part of it, or even Kaposi sarcoma, herpes virus type 8 is the one causing Kaposi sarcomas. You can see here that HSV1 and HSV2, they target mucoepithelial cells, but also they have this latency in neurons. And that's why I'm going to explain to you in a few slides ahead why we cannot get rid of them. The target size for herpes, of course, HSV1, you can potentially, develop very rare, but you can develop encephalitis, conjunctivitis, and so on. Some of the other problems, but of course, the one we're going to be mostly talking about is genital herpes. HSV2 also can be related to meningitis, but also genital and oral herpes as well as HSV1. Now, the difference between HSV1 and HSV2 is really not too much of, it's depending where they're located. There are two different types of viruses, but HSV1 is called also the above the waist herpes. So is mostly HSV1 is the one causing type of oral herpes, but still 10% of genital herpes could be HSV1. Meanwhile, HSV2 is called below the waist, and where 90% of herpes in genital herpes are caused by HSV2. So they, of course, cause these benign with clear vesicles, red base, and this contains infectious viruses. Difference between genital and oral herpes, again, as is location, but not the viral type. And you can see here, the classic lesion of oral herpes or genital herpes. Now, the primary infection is the site of viral entry through mucous membrane, almost always contract through sexual activity. The incubation period is between 2 to 12 days, and the mean is around 4 days. The symptoms, painful or itchy lesions around genital or rectum. The lesion progressed, they form these papules, vesicles, pustules, ulcers, and crust. Heals in around 2 to 4 weeks. Virus shedding 12 days from onset of the symptoms. Some people are unaware of infection because some people, they have mild to asymptomatic disease. Other people that are immunocompromised that can develop severe disease, and series of sores, flu symptoms, fever, swollen glands. And these are just examples of, genital herpes in a penis or a vaginal area. Now, recurrent infections normally happen 4 to 5 outbreaks within a year. Now, the lesions are less severe, they're shorter in duration and less frequent with time. Maybe asymptomatic, but contains infectious viruses. Much of SSV2 transmitted during asymptomatic shedding. So that's one of the other issues with herpes viruses. Some people are carrying the virus, that are completely asymptomatic, but that doesn't mean that they cannot infect their sexual partners. Two modes of infection is the lytic replication cycle. So in the moment that the virus infects mostly the epithelium, destroys the host, and then the latent the host cells. But then the latent replication cycle is mostly a viral genome persists in the host cell. HSV is not efficiently released into extracellular space rather attach and penetrate adjacent cells characterized by local spread. That's why you see lesion, when you see herpes lesions, is very focused, is very localized in a specific area. Lesions at distant sites are rare, and systemic disease also pretty rare, mostly in newborns or people with severe immunocompromised issues. So this is a reason why it's very hard to get rid of herpes viruses in the moment they infect you, because the thing that happens is really the viruses infects the first cells that infects is your epithelium, and that's when they have this lytic replication. But then the virus actually have the ability to get into sensory neurons, and in these sensory neurons they can actually migrate all the way to the nucleus of the sensory neurons and stay there in that latent state, meaning their genome is almost completely dormant. So in the moment they get there, it's almost impossible to get rid of them. You cannot. There's no drugs or anything we know that is capable of getting rid of neurons that are infected with the virus. And then, of course, it could be several weeks, months, or even years when these, for physical or even mental stress, these viruses that are in a dormant state, they get activated, and then they now are able to migrate back to the area where they were there was a primary infection or close to the primary infection, and they reinfect the epithelial cells, and then is your reactivation of the virus. And yeah, they cause the prodrome, disease reactivation, and then, like I said, the lesions appear, but they're not as dramatic as the first infection. Now, neonatal HSV is actually not a very good thing. Cesarean sections decrease the risk of HSV during active infection. Neonatals that can be infected with this, they can disseminate to the central nervous system. They can develop encephalitis, generalized seizures, or high morbidity or high mortality. So this is definitely, and this is related to the immunological immaturity of the neonate, and so it's HSV2 is worse in neonatal infection than HSV1, obviously because it's more in the genital area. But yeah, it's something that definitely pregnant women have to be aware and be careful to don't pass it to their babies. All pregnant women should be asked about and examined for genital herpes, of course, to avoid this. Replication. The virus, of course, binds to the cell. Then, because they have a membrane, they fuse their membrane, and then it's a DNA virus. Of course, they have to go all the way to the nucleus, and then in the nucleus, actually, the HSV encodes their own DNA polymerase, and this is a very important thing because that's why we were able to develop drugs like acyclovir that can target specifically the DNA polymerase of these viruses. So most DNA viruses, they don't express their DNA polymerase. They steal the polymerase from the host cell. But in this case, herpes viruses, in their replication process, they express their own. So it's a good target for drugs. And they have this replication, it's called rolling circle model of replication. They have these immediate early genes, early genes and late genes, like any virus. The immediate early and early are mostly related to transcription and replication of the virus, and late genes are mostly structural proteins. And yes, like I said before, the advantage of this virus to express their own DNA polymerase is that we can use drugs against it. And one of them is acyclovir. So acyclovir is really nothing else other than a guanosine analog. So you remember your class of genetics. Guanosine is one of the nucleotides that any organism, including viruses, they need to make more DNA. So acyclovir is just an analog that looks like a guanosine. So in the moment that you add acyclovir to a cell, the acyclovir has to be actually phosphorylated. And the moment it's phosphorylated, the virus DNA polymerase gets stuck with this molecule, with this acyclovir, and now they cannot complete replication of the viral genome. And the advantage is that acyclovir so that inhibits the HSV DNA polymerase. The advantage is that it's 10 to 30 times most effective to target the DNA polymerase of the virus than the human DNA polymerase. So it's quite specific. So that's why acyclovir is very good against a different type of herpes viruses. Diagnosis, clinical presentation, of course, painful vesicles. Percentage diagnosis, the SANC test, like I said before, is not specific for HSV, but just mostly viral infection. Definitive diagnosis, of course, viral isolation in cell culture, or of course, you can do a PCR, direct immunofluorescence, or even serology to check to really narrow it down to even to know if it's an HSV1 or HSV2 infection. Acyclovir is not the only anti-herpes virus drugs. There are other ones, and just acyclovir is the most common one used, but you can see here there are other guanosine analogs that are being used before against herpes viruses. Host defense against HSV, of course, infection-induced innate immune response, cell-mediated immunity, most important recovery mechanism. Also, the passive maternal antibodies that is important in preventing newborn infections, and cell-mediated immunity with interference may prevent symptomatic lesions and recurrence. Now, of course, people that have high susceptibility against HSVs, people that are highly immunocompromised, like for example, infants less than 1 month or 1 month of age, or people in that have bone marrow transplants, or kids with leukemia, or HIV patients. Now, something with HIV I'm going to show you in a second is very interesting, because the thing that happened with HIV look like there's a synergistic events with herpes viruses and HIV. So when a virus, when a patient has HIV, is an HIV positive, and they get infected with HSV2, look like the HSV2 infection increases risk of HIV infection even twofold. And HSV and HIV can co-infect the same cell. Has been shown that, and that's actually something very interesting, because when a virus, they kind of help each other. So the effects of HSV2 on HIV is that if a cell is HIV positive, but then they get infected with HSV2, there's a higher increase of HIV acquisition in the patient, HIV transmission, and HIV levels in the plasma and genital tract. Now, from the HSV perspective, there is more frequent and prolonged atypical lesions. Of course, it makes sense because the person is a little bit immunocompromised in the beginning, and then frequency of HSV2 sheddings and HSV2 acquisitions and transmissions are increases. Also, there is evidence of acyclovir resistance when HIV is there. So acyclovir treatment of HSV decrease HIV viral load, telling you that in one way or the other, look like both viruses are kind of helping each other and maybe sharing certain pathways in the cell. Recently, these people, of course, trying to develop vaccines against HSV, but they still, they're still working on it. There's nothing really, concrete yet. This is just a paper that came out in Science Immunology a couple of years ago to show that, some people are working on that with these nucleoside modified messenger RNAs encoding HSV2 glycoproteins. But again, we don't have, unfortunately, a vaccine against HSV. Herpes simplex transmission, of course, released from viral source. HSV2 generally acquired during sexual contact. HSV1 can cause again genital herpes. More commonly cause infections in the mouth and lips. Can be transmitted by oral genital or genital contact. HSV vertical transmission occurs during pregnancy. Infected, of course, from mother to baby. Barrier contraception, of course, is effective in preventing transmission. And major factors of HSV transmission is unrecognized or subclinical infections. Again, that's the issue. A lot of people could be completely asymptomatic, but that doesn't mean they cannot be infectious. Humans are the primary reservoir of HSV, so technically, in the future, we can develop a vaccine against HSV. We can eradicate it, but unfortunately, we don't have it yet. In the U.S., there's an estimated 40 to 60 million people infected with HSV2. And we have more than, around 700,000 new cases of HSV2 per year. 80 to 90 infections are, of course, undiagnosed. They're higher in women, unfortunately, in African American population, and sometimes correlates with number of sexual partners, age of initial sex, presence of other sexually transmitted disease like HIV. The prevalence in different countries vary, but it's very similar to the United States. Complications, most commonly complication of genital herpes is recurrent episodes, neurological complications or meningitis that could happen, but very rare. But mostly the thing that causes in people is mental anxiety. So counseling should include transmission prevention issues, therapeutic options, recognition of prodromal symptoms, and prevention of risk of neonatal infections. So that again, so this is not a deadly disease, but is very cause a lot of anxiety, mostly young persons that are infected with it because they don't know. Most of them, they don't even know they have it. Any questions before I go to HPV about herpes viruses? No? Okay, so let me go through HPV now, a completely different type of virus. This one can cause skin warts, flat warts, plantar warts. So most any type of warts that you can think of in the skin or in the genital area are caused by HPV. Now there are different types of HPVs. Now we're gonna go in detail with them. Now you'll talk a little bit about viral oncogenesis. In 1911, Peyton Rose confirmed that cancer was transmissible. He inject cell-free, bacteria-free filtrate of chicken sarcoma tissue to sarcomas and create sarcomas in chickens and injection sites. So that's how they were actually understand there were some viruses that could be related to cancers, and that's how they identified their Rose sarcoma, or this is an RNA tumor viruses. And for the reason, of course, this guy won a Nobel Prize in 1966. Now we know they are not only RNA tumor viruses like these Rose sarcoma viruses or HTLV or hepatitis C cause liver cancer, but we know that they are DNA tumor viruses. Hepatitis B virus, Epstein-Barr, Kaposi, SV40, and in this case, HPV, the one we're going to be talking about. Now we know that 15% of human cancers are associated with viral infections. Now, in 1932, Richard Shope identified the first papilloma virus or papilloma tumor virus. And here is a cartoon of a jackalope. I know you guys heard these stories in the South Park, United States, of people saying, your uncle that likes to drink that says, hey, I just saw this rabbit that has these horns. And of course, people develop these stories about jackalopes, this mythological rabbit with horns. But maybe they were right, because actually there is Richard Shope was the one that actually discovered these rabbit fibromas growing out of the head of rabbits in the wild that look like horns, and they're actually caused by specific papilloma virus that infect rabbits. But it was not until 1976 that Harold Surhausen published the hypothesis that human papillomavirus could be very important in the role of developing cervical cancer, and specifically HPV-16 and HPV-18. For that reason, he actually won the Nobel Prize in 2008. The papilloma structure, we know, is of course part of the Papillomaviridae family. They have this circular double-stranded DNA virus. They are very small. They're only 52 to 55 nanometers. They are not enveloped. Stable capsids allow virus to remain infectious. They have this icosahedral shape and are very species-specific. So we know papillomaviruses, every mammal that we know exists in this planet, we already identify a papillomavirus that infect them. From rabbits to humans to whales to anything you can think of, they all can be infected with different type of papillomaviruses. But papillomaviruses are very species specific. So human papillomaviruses only infect humans, rabbit papillomaviruses only infect rabbits, and so on. So human papillomaviruses, the lesions, they, you can see here that there are more than 200 classified type of HPVs, specifically human papillomaviruses that we discovered. Most of them, like the plantar and palmar warts, are caused by HPV 1 to 4. The anogenital warts are mostly caused with these low risk papillomaviruses like HPV 6 and 11. But the most important ones to study, of course, in cancer, cervical cancer, and related cancers is HPV 16 and 18. And of course, the other highly risk papillomaviruses like the 30s, 40s, and some 50s. HPV infection, mostly the mucosal genital tissue. And like I said, they are low grade and high grade. They're low grade and mostly related to warts, the high grade mostly related to cancer. Now, this is just a cartoon to show you a very simple, genome. The HPV genome is very simple. They have these early genes or E genes, and these late genes or L genes. The early genes like E1 and E2 are mostly related to replication. E6 and E7 are actually the oncogenic proteins that the virus express. L1 and L2 is mostly to form the capsid. Now, the interesting thing about the HPV, they need to infect the basal layer of the epithelium. So there has to be a cut, there has to be an abrasion in the epithelium. So the virus can actually go all the way to the bottom of the epithelium and infect these basal cells, because these are the cells that are actually in the process of replication. And the virus needs that in the very beginning. And then, of course, in the epithelium, the moment that these cells start migrating to the surface, they are differentiating. So the virus also used part of that differentiation part of the epithelium to express other different type of genes. Just to show you, like I explained to you, E1 and E2 mostly replication. E6 and E7 are actually the most important genes in HPV, because are the ones actually causing or related to carcinogenesis. So benign infections of human papillomaviruses mostly related to genital warts, affect most genital tissue. They're small, flesh-colored bumps, may multiply into large clusters. In women, growth in the vulva, also the vagina, or external genital, the anus or the cervix. In men, mostly in the shaft of the penis, scrotum or anus, and warts can develop in mouth or throat from oral sexual contact. Benign infections, diagnosis generally based on appearance, soft, moist, pink, or gray polyps, usually found in clusters. You can see here, for example, in this picture, HPV genital warts that is very different from syphilis or genital herpes. Treatment, 50% of warts regress spontaneously. Most HPV infections, our immune system is very good detecting them and getting rid of it. Genital warts, they can be removed by cryotherapy, excision, or electrocauterization, laser, and so on. Less effective, of course, is interference of topical antimitotics. Urethral lesions, you can use a different other type of techniques. Now, HPV does not encode enzymes for nucleotide production of DNA replication, so for that reason, isaclavir cannot be used against HPV. Now, genital warts diagnosed by age group, in men and women, you can see there the most prevalent STD in adults and in young adults is HPV. And the way they induce or involve in induced carcinogenesis is that you can see their genome of the virus is circular, but the virus, in the moment they infect cells, the cells become very genetically unstable. And then suddenly the virus sometimes integrates into the host genome. This is not part of the viral replication, the viral life cycle. The virus doesn't want to integrate into the human genome, but most of cancers that we know that are HPV related, they have HPVs integrated to the genome. And most of the time, there is always, because it's a circular genome, there has to be a cut in the genome of the virus to integrate. And interestingly enough, most of the time, the place that get caught is E2, and E2 is actually a natural repressor of E6 and E7. So in the moment you lose E2, in the moment of integration, there's a higher expression of E6 and E7 that now we know E6 is very important because they target the main tumor suppressor gene in our genome, that is P53, and E7 target the retinoblastoma protein. So for that reason, E6 and E7 are super important because they target our tumor suppressor genes, and that helps the cell to accumulate more mutations, and unfortunately can cause cancer. This is just a cartoon to show you again how the carcinogenic progression, the virus has to infect the basal layer of the epithelium, and they start shedding, the moment the epithelium start differentiating, they start shedding more viruses. But after several years of infection or reinfection, some of these viruses can integrate into the host genome. In the moment of integration, the cells become immortalized, and then after immortalization, they start accumulating more mutations until they become carcinogenic, and they start, they can invade tissue, or they even cause metastasis. So the disease, of course, of human papillomavirus, the most important is cancer. They are the high risk HPV types, like HPV 16 and 18, like I told you before. Remain 22% caused by other high-risk HPV types. High-risk types identify in 90% of anal cancers, 60 to 70% of penile, and 20 to 80 of head and neck cancers. Most of the head and neck cancers, interestingly enough, are mostly caused by HPV 16. This is just a Pap test. You can see, normal Pap test here to the left, but then, and these two are actually normal Pap smears of benign squamous cells. But in the moment you start to see this dysplasia, perinuclear cytoplasmic clearings in Pap smears, that's when you realize that it's a viral infection and most likely an HPV infection. And then you start to see these multinucleated syncytial giant cells. That is also evidence of viral infection and potentially transformation in that area. Papillomaviruses, not only infect females, but infect males. And you can see here oropharyngeal cancers in males. A good percentage is attributed by HPV. Meanwhile, of course, the cervix, most of the cervix is related, cervical cancer is related to HPV infections. The stages of cervical cancer, of course, the earliest stages, the better prognosis they're going to have, to 80 to 93%. But the moment that the stages start evolving into stage 2, 3, or 4, the prognosis start going way, way down, all the way to 50%, when there's, of course, metastases and to other organs. Fortunately for us, now we have several vaccines against HPV. The first one that was released was in 2006. That was Gardasil by Merck. And this vaccine was mostly targeting HPV type 6, 11, 16, and 18. So you can see here that we're not only targeting the high-risk HPVs, but also the low-risk HPVs related to genital warts. Then in 2009, Cervarix came out, and that one only was targeting the high-risk HPV 16 and 18. And finally, in 2014, Gardasil 9 was released, and this Gardasil is called Gardasil 9 because it actually target 9 different HPVs from low risk to high risk, not only targeting 16 and 18, but also the 30s, 40, and some of the 50s. So, I think every new form of vaccine against HPV is becoming more and more, trying to cover more and more of these type of infections, and they are actually quite good. The only issue is, of course, these vaccines work very well for people that are not being infected by the virus. So that's why it's important to vaccinate teenagers and kids in their ages, and they're around 12, 13 years old, men and women. And but people are already being infected by HPV. Unfortunately, these vaccines are not therapeutic, so they cannot get rid of them. So they will not cover them for that. This is just the safety protections of HPV, showing you that the CDC recommends 3 doses for kids between 11 and 12. Transmission, of course, HPV is through sexual contact. Intact skin is an effective barrier. Increased risk with high number of lifetime sexual partners. Protective factors could be circumcision, consistent condom use, and abstinence. Virus can be transmitted by inanimate objects. Very rare, but that could happen. Co-infection with multiple HPV types can occur. So yeah, their patients sometimes they show up and they have HPV 16 and 18 at the same time. Laryngeal warts can be acquired by neonatal during birth, and rare aspiration of HPV at birth could cause respiratory papillomatosis. And that's it, guys. This is the table I normally give at the end of my talk, so you guys can study all the information I give to you. And if you guys have any questions, this is the time to ask. Any question, guys? Questions? No? Okay. Well, thank you. Wait a second. I see stuff in the chat going on. Give me a sec. No, just say thank you. Okay, you're welcome. And you guys don't have any questions. So thank you guys for your attention. And I will talk to you guys soon. And good luck. And goodbye.